So we're going to start professionalism today. I want to introduce Dr. Hong Tai. Hong is a dear friend of ours. She's a graduate of our program, and she was the chief resident here before, and she's been a hospitalist with Team Health for a year now. So really not too far removed from where you are all at today, but she's an outstanding faculty, an outstanding person, and she is one of our core faculty this year as well, starting this year. So really asked Hong to do this. She's actually a winner of the Healing Hands Professionalism Award that we give out each year to at least one or two of our residents. So she's really a role model, I think, for professionalism, and very happy to have her here giving this lecture to all of us. So thank you, Hong.
Hello, guys. All right, so I'm Dr. Tai. I think I'll be working closely with a lot of you guys on your awards month. So show of hands wise, where are my PGY ones at? Okay. And the twos, my threes. Okay, sounds good.
Is this where they sat back when you were resident too?
No, we tend to club together. I think. So I think it's still
We had
the
our
same.
cliques.
Yeah. So when I was asked to give this talk, I gave it a lot of thought to how you can approach professionalism. Because if you really think about it, a lot of it sounds very common sense, right? Just your attitude and your behavior at work. So one approach to do it, I guess, read you the rule books and say stick by it, or you're gonna deal with the consequences, right? You're gonna see Dr. Ragawan in his office. But I think upon reflection, I think a better approach is to remind you guys over the next hour of the importance and the value behind your work, why you're here, and then with that, I think the rest tend to fall into place once you understand, your mission. So let's start with a show of hands. How many of you guys have been sick, hospitalized, or have a family member or loved one that you care a lot about who's sick and hospitalized? Yeah, so the majority of you guys have had to deal with this experience, myself included, and as well as my friends here. So, next.
Okay.
We just
There we
have
go.
to click. Yeah.
Okay, so if you can do me a big favor, this will be the only time I make you whip out your phone. Go to pollev.com. Oh, did y'all lose the link? It's my first name Hong, last name Tai. Oh, it doesn't switch over.
I think click on enable editing at the top.
And then go screen.
It's wrong.
Is that her birthday or her ATM pin? Oh no, she is.
On your work phone, perfect.
I thought she was.
There we go. Perfect, thank you. It's 533. So my name, my last name, 533.
Mine's not loaded. Okay.
So pollev.com/Hong, H-O-N-G, Tai, T-H-A-I, 533. And just in one word, and you can answer multiple times too, but just one word at a time.
Oh, we can't. That's a maximum amount of
But I just wanted to, I don't hear you. I mean,
helplessness, sad, hopeless, worried, overwhelmed, distraught. I mean, these are all pretty heavy emotions that you guys at one point have felt in your life, right? So the reason why I brought this up is because anytime you come to work and you walk into the door, this is what we're tasked to deal with, to take care of the patients and the family members that you see daily, is hoping that as their physician, you guys are helping to address these emotions, right? So this is a big responsibility to be placed on us as healthcare professionals. And it's easy to forget sometimes as we go through our daily mundane tasks of showing up, like, seeing your patients, rounding, getting the orders in. It's the grind that gets to us at the end of the day. It's waking up and doing the same thing every day. But I think what has helped me through residency and through some of the tough time, because my colleagues are here in the front, we went through COVID, training at the peak of COVID, and it's easy to forget why we're here. And so I think this has really helped me to reflect back on when my dad was sick and the emotions I felt, and that every patient you encounter is feeling these things, and you are in the position of power now to really make a difference, right? So just keep this in the back of your mind as you, I hope, go through your career, this word cloud. So, can somebody help me read this quote from the AOA?
Sure.
Oh, now I gotta go back to the slide. Okay, no one switched back. Okay, so who can read this? I see Josh. Okay.
Professionalism starts with physicians understanding their obligations and commitments to serve and care for people, especially those who are suffering.
So we're no longer medical students learning out of a textbook. You guys are transitioning now to a real job, getting paid, and patients can either improve under your care or really suffer under your care. So I just want to really emphasize, we're in a really unique position in society where your work really does make an impact on someone's life, and there's a lot higher at stakes than, typical 9-to-5 jobs, right? So I think how I'm going to approach today's topic is, this is my outline. We can start with the 4 competencies of ACGME. Then we will attempt at defining professionalism. It's a hard topic to define. And we'll discuss what attributes make up professionalism. What are some signs and symptoms for the lack of professionalism? Can this be taught, and can it be assessed? So that's the age-old question. Or is it innate within each one of us? And we'll review the HCA mission values and some expectations we have. So I think you guys have seen this before. These are the 6 core competencies that ACGME has. It's required for residents to graduate any residency program, right? So I really want to emphasize, and what we tend to forget about. So as we strive to learn more medical knowledge, learn how to take care of our patient, learn how to play central line, remember at the background of it all, professionalism is one of the pillars that you need to meet in order to graduate, okay? And kind of bringing it back to the word cloud that we just had, how do you help alleviate some of those negative emotions that your patients and that their family members feel? What do you think is the number one thing that patients look for in you guys?
Interpersonal skills.
Huh?
Interpersonal skills.
Interpersonal skills, okay. Good.
Your time. Your time.
Your time, good.
Communication.
Huh?
Communication.
Communication. What do all of these help establish? What are you trying to establish with your patient? Trust. Yes, rapport and trust. So it all goes back to trust. But what is the foundation of establishing trust? It's professionalism. You guys are already pointing out words that are basically attributes of professionalism. So we'll go into more details of that. So since the dawn of time, some say decades ago or centuries ago, think Hippocrates and philosophers have tried to define professionalism. And it's hard, it's a hard topic, but within, the last decade or so, ACGME is adding professionalism into your core competency, and now it's really upstart, making people really think about, is this a topic that needs to be taught? And so simply put, like I mentioned earlier, it's just your attitude and your behavior when you show up to work. And I think this is really important to keep in mind, that professionalism is the basis of medicine's contract with society. And so this is a contract you guys have all at some point signed and not realized. It's not a written contract. No one gave you a contract to say these are the professionalism things you need to abide by and sign it, right? But society is placing their trust in you as their physician to take care of them. It's unspoken and unwritten, so remember that. Essential to this contract is the public trust in the physician, which depends on the integrity of both the individual physicians and the whole profession. So, as the new class, right, you guys are now PGY1s, we have 2s, 3s, and really my colleagues as well. We're the new representatives of medicine, the healthcare profession as a whole, correct? So if you've been watching the news, there's been a lot of tarnish, mistrust between society and medicine, healthcare as a profession. So I think it is not just our duty to learn, to attain medical knowledge, to take on procedural skills. Those are easy to assess, but it's also our responsibility to restore this trust in society, right? Yeah. So you're playing a big part. It's not just your interaction with the patient, you are now representing the whole profession. Okay, so I'll leave you with a quote: with great power comes great responsibility. Who said this?
Spider-Man.
Spider-Man?
Spider-Man.
Spider-Man's uncle, yeah. So you're right. It's Uncle Ben. He said it. And it's true, right? You are in, I think we tend to forget, right? There's a high totem pole. Medicine, in particular, has a big totem pole. I'm a lowly medical student to now I'm a lowly intern, and now I'm just a PGY2, I'm just a PGY3, oh, I'm just a new attending. There's always people ahead of you with more experience. But remember, starting today, well, July 1st, as an intern, you are now in a position of great power, okay? Your attendings is going to rely on you to obtain a good medical history and physical when the patient hits the door. So as an intern, if you miss the boat, cut the corner on your physical exam, cut the corner on your history, the patients suffer. So you play, I argue, the intern plays a crucial role in the team dynamics here at the hospital, right? You place the Lasix that's gonna make the patient breathe better and feel better and exit the hospital. You can place an order, hopefully, non-intentional, that can really cause harm and cause death to a patient. So just keep this in mind as you move forward. So a lot of studies has been done, and I had to sift through a lot of long articles, but basically they distill it down to 7 pillars. Okay, so there's 7 points that make up professionalism. One is altruism. That's self-explanatory, right? What is altruism?
The pursuit of the good to others.
Hmm?
Pursuing the good to others.
Yeah, but even more than that, you're putting their interest above yourself, right? So how would you tie this back to your day-to-day as a resident? What is an example of being altruistic as a resident?
Skipping your lunch.
Huh?
Skipping your lunch to take care of it.
Yes. We hope you're not skipping your lunch, but good. Yes, you're hungry, but things need to get done, so you're gonna take care of it because for patient safety. What's another example you can give? Maybe Dr. Wynn has a party at home, but he has to skip the party, he needs to stay here, make sure his patients are tucked in for the day, right? So that's your job. You need to tuck in your patients before you walk out of the hospital, and just remember before you leave every day to say, this is the best that I could have done for my patients for today. And if that's a yes, then good, you can go home, right? Okay, accountability. This is really important, right? I really want to emphasize accountability. So what is accountability? It's the admittance to error, right? Taking accountability for your wrongdoing. But even more than that, taking accountability in your peers and your faculty members, your attendings even. If you see wrongdoing, it is your job to speak up, right? If patient safety is at risk. So what's an example you can give me of accountability?
Making an error while documenting.
Making error while documenting, okay. And taking accountability for it, okay. Maybe doing an addendum, saying, correction, this is what I meant. Good. One more example.
Wrong order.
If you didn't do something, don't please do it. Like, say, hey, I didn't do this. I'm sorry, I'll do it. I'll go do it.
Absolutely, absolutely. So nowhere in today's talk are you going to hear the word perfection, or you have to be perfect, or you cannot do wrong, right? So we are all humans, and you can be 15 years into your practice, 30 years into practice, and still miss something, and still make an error. But it's about holding yourself accountable, right? Setting the bar really high for yourself and meet that bar. So no one's going to set this bar for you. Does that make sense? Okay. Excellence. So what's excellence? What do you guys interpret this to be? So it's basically you're being asked to promise to continue medical education. You're going to strive every day to improve your knowledge. It's a lifelong learning career that you've signed up for, right? So I still see our ICU attendings years into their practice reading every day. Okay, so this excellence is just that commitment you've made. What's for? Duty. That's the mundane task every day, right? Placing your orders. What's your responsibility as an intern? What is your responsibility as a PQI2, a PQI3? You promise to oversee these orders. So you're not gonna walk out of the door before you say, hey, have you guys placed these orders and follow up on it? Interns, your duty is to place the orders in an appropriate time, to get a good history, to do a good physical exam, and take care of the patients, right? So that's duty. And what's honor? And I really want to emphasize honor because I don't think we do this enough. Taking pride in your work, right? Being proud of what you do for your patient. We don't ever take a moment and celebrate the people we discharge and have good outcome. And I remember that. You tend to remember the adverse outcome. You tend to remember the patients that don't make it. But I tell my interns all the time, there's, at the end of the week, your stack of the patient list that you have in your pocket, look at them and see how many people do you successfully discharge home. Those are all accomplishments that you've made. And so remember to celebrate that. And next is integrity. What's integrity?
Honoring your word. Like if you say you're gonna get something done, get it done.
Yeah, being dependable, being trustworthy, somebody your attending can always rely on to tell the truth and not lie and to do the right thing. That's your integrity. And 7, of course, is respect for others, right? We always want to treat others how we want to be treated. So these are breaches professionalisms, and we can go over it briefly, but one is an abuse of power. So what's abuse of power? Give me an example, I guess.
Like if I make the residents go get me coffee or do my.
Yeah. Yes.
Your errand for you.
Do the dry cleaning for him.
Or in like a doctor-patient context, trying to pressure patients into a test or like an exam that they might not necessarily want or need. They still have some degree of agency even though you're their physician.
Absolutely, yes. The physician-patient relationship. They depend on you with your medical knowledge, right? To order only necessary tests stick them only if you have to stick them, not order unnecessary labs. What else? Maybe a PGY 2 or 3, seeing the census is high, the intern overwhelmed, but not feeling the need to step in and help, right? Hey, maybe I can write a note for you today. I know your patients were really sick today. Hey, I know it's just because we're not asking upper levels to write notes doesn't mean you can't. You should if your intern is struggling. Right? Okay. And breaking HIPAA, that's an abuse of power too, right? The breach of confidentiality is under the abuse of power. Okay. 2, poor interactions with patients and colleagues. This is just basically goes back to respect, right? 3 is arrogance. Really want to emphasize this point as well, right? And I think we're in the medical profession can be very guilty of this, I think, attributes as breach of professionalism. What is arrogance? It's an offensive display of self-importance, right? Not admitting you could do wrong. If you're attending, say, hey, I prefer this, or I'm giving you a negative feedback, maybe constructive feedback, you don't feel it's right, you're right, they're wrong, that's arrogance. And then you see attendings do it too, we're just as at risk of this professionalism trait. Misrepresentation, okay? I do see this, unfortunately, it's not uncommon. What is the difference between lying and fraud? And I asked my fiance this, who's not in medicine, and he explained it perfectly clear. So I think you can do it too. What's the difference between lying and fraud? Yeah, I put the answer up there already, so you just need to read it. Okay, lying is basically consciously not telling the truth, right? You did not do the physical exam, but you said you did. You did not order the lab, but you said you did. You did not check tele, but you said you did. And why is this so important and detrimental to patient care?
It leads to misdiagnosis.
It can lead to misdiagnosis, yes.
Mistrust.
Mistrust, it goes back to that again. The foundation of professionalism is trust, right? All we're trying to do is establish this trust. Good. What's fraud? So lying is just like you're not saying the truth. But fraud is you're lying with the intent to mislead somebody, right? That's fraud, and that's serious. Well, both of these are pretty serious. Both of these are serious breaches. 5 is impairment. What's impairment?
When you're drunk,
Showing to work drunk, yes. Knowing you're on call tomorrow, gonna have a long day, but staying out late the night before, right? Any other examples you could give?
So is anything that makes you unable to perform your duties at work?
Absolutely.
You're expected to perform them. So it doesn't necessarily need to be shown that hungover, but if you're doing anything that's going to result in you not being able to perform your tasks.
Yes, anything that is going to prevent you from performing the job at hand. Good. And conflicts of interest and greed. I think 6 and 7 kind of more so relate to post-residency. But just keep this in mind, right? Okay, so can somebody read this quote? I love this quote from Dr. Jordan Cohen. Maybe Ruben.
There is a tendency to underemphasize the personal characteristics, as they are harder to measure, and to overemphasize the more easily measured indices of academic achievements.
Do we agree with this statement? How many of us have been frustrated in your training where you care a lot, you spend a lot of time with the patient, but you may not know all the medical facts and questions that your attending is asking. And there's always that one, medical student who knows all the answers but does not care and probably doesn't even see their patient. How many of you guys have been frustrated at that? I only see one hand. I definitely have experienced this before, right? So I think this is true. I think as us in the teaching on the teaching side, on the administration side, I think we can do a better job with emphasizing the importance of medical ethics, professionalism, providing compassion care, over just focusing on things that are more easily measured, which is the medical knowledge, let's say, high test scores, right? So I think this is where we can improve and say, hey, I really appreciate you going back and seeing the patient today and offering her comfort. So I think this slide more so pertained to the attendings in the room. And I think what's great was, I think when Dr. Ragavan started coming here and working with us, he started the Professionalism Award because it should be recognized, right? Outside of just the highest test scorers or the most outgoing, I think. Okay, so can this be taught? So do you guys think professionalism can be taught, or do you think it's innate?
Can be taught.
Innate and can be taught?
You can also improve on it if it is innate. You
Both.
always have room to improve.
So most likely, we all can learn to be more professional.
Yeah, teaching professionalism is hard. So the more I did my research, the more I'm like, man, this is a really big topic for 1 hour, right? And so I didn't even know all of this research and studies have been put out and people have written so many articles about this. So there's a lot of arguments about can it be taught, or that's just a bad resident. That's just a lazy resident. I can't change that. She's just lazy, or he's just lazy. But I think it can definitely be taught through all of my research. What I found is the AOA kind of brought up something, and I want to read it to you. It says, although most programs have curricula related to professional values, so, we have medical ethics course, even in medical school, they offer medical ethics course. What they're saying is what residents learn and retain is from what is called a hidden curriculum. So I had to look, what is a hidden curriculum? So if you look here, hidden curriculum is the day-to-day experiences of residents working in the clinical environment while watching, listening, and emulating their colleagues and attending behaviors. So we learn by watching and emulating others, right? So what does this tell you? How can we develop a professional culture here at Kingwood? Who is responsible for making sure all of our residents are professional? Is it Dr. Ragavan?
I would say everyone at every level.
Everyone at every level, exactly. Your interns is looking to the upper level to do role modeling, right? We're looking to your attendings and see how they're doing bedside teaching. How do they conduct themselves in front of patients, right? And then, of course, small group discussions, having, discussion throughout the year. So the most effective programs lead by changing the entire culture and environment to respect and reward professional behavior. And this is a statement coming out of AOA themselves. Okay? So look around you at your table, right? So hold each other accountable to do good, hold each other accountable for the errors that your friends make, and then how you carry yourself in front of patients is how your friends likely going to do the same thing. If you leave early, your friends will say, maybe I could leave early too. So every action or every decision you make moving forward in the next 3 years or 1 year from my TY has a consequence, right? It's a ripple effect. So please do keep that in mind. And so I really do encourage you guys to help us participate in this quote unquote hidden curriculum. Because at the end of the day, who here does not want the patient to get better? No one, right? So can it be assessed? So it goes back to if you're going to teach it, you need to be able to assess it. And sure, we can. That's through peer evaluation, faculty evaluations, patient surveys, and professional. Every one of us have a professionalism portfolio, including myself, right? Including Dr. Ragavan. So keep this in mind. So I want to kind of lead into some case discussion. Anybody up front want to read this case?
You're now the PGY1 resident and now several months into the year. You have found the experience of being an intern to be very challenging, but you have learned a lot and have generally enjoyed the experience. You are preparing for your first ICU rotation and have arranged to speak with your fellow intern who is just completing the ICU service so you can get the inside scoop on the unit so that you can be ready for day one. When you meet with your colleague for coffee in the hospital cafeteria, he goes through the activities of the day in great detail, which is very helpful to you. He then starts to discuss the attending physicians and nurses in very critical ways, including insults about their patient care. If I were admitted to this ICU, I wouldn't let him near me. Work ethic. She is so lazy. She wouldn't get out of her chair for anything other than a code, and she makes the intern do everything. Rumored personal relationships. I know those two are hooking up in the on-call room. This conversation makes you feel uncomfortable, and you think that you see people at nearby tables looking over at your colleagues as he is talking because they too can hear him. Later that day, you're talking to another fellow intern who is a close friend, and you discuss what happened. She says, "That doesn't surprise me. You should see his Twitter feed. It is nothing but complaints about work." Discussion, or do you want me to read that too? Or?
Sure.
Okay, discussion question. What are some professionalism issues raised in this scenario?
Yeah, so let's start there. What's going on?
You want to give them time just to talk and then.
Sure, you guys can discuss at your table.
All right.
That's a lot to unpack
Everyone. I think, yeah, the people nurses, but it is. Yeah, okay, so I guess is there an appropriate time? And is there I think parents with the question is late. What's gonna
We don't have that machine.
Okay, so one, what are some of the professionalism issues raised in this scenario?
You may have to pick a table. huh?
Yeah, probably. Let's go with an intern table. Over there. Yes. Yeah.
But we're not
No, right here. Right by. Right under the camera.
Most of the things they said weren't very professional. I think they attacked their character, and I think it was not a good use of social media policy. We did a lot of modules, and we shouldn't be saying those things on social media.
Yeah, good. Anyone else? PGY2s over there. I think there's a clump of PGY2s in the back. Allie's table.
Oh, just like, it's kind of common sense, like, don't talk about other people. You know, if you have an issue, go to the source or report it, don't just, you know.
Yes, good. So this it goes back to the pillars of professionalism has been preached.
Respect for others.
Yeah, integrity and respect for others. Good. Okay. So how do you think they should have approached it differently? Question number 2. What could they have done differently if they were upset about a fellow resident being unprofessional?
I think that you should have, number one thing would be not to talk about this in a open area, public area such as cafeteria, because a lot of times we forget that even though you're upset, as humans we all can be upset. If you're talking to somebody else, or patients or other patients around you, that you're sort of building this sort of impression about this whole facility and for them, and that they're going to take that impression with them, and you shouldn't display those sort of emotions in an area where you're part of. You chose to be here, you should respect that. You could have negative emotions. I mean, sometimes you don't get along with certain people, but you should, if something that you can discuss with that person privately, then that's even better. If not, then obviously go to HR or go to your senior supervisor and discuss these things that are, not about their personal life, but more so about if you're treated a certain way.
Right, absolutely. I can't word it better myself. Good. Yeah, so it's just about, and we're all humans, right? So we all have emotions. We're not gonna all like each other over the next few years. There are gonna be situations where you get annoyed. But part of being professional is addressing it in an appropriate manner, like you said. Good. Okay, so group discussion case 2. Okay. You're a PGY1 and have just received 8 brand new patients on your very first day of floors. Between trying to learn the EMR and the hospital layout and learning as much as you can about your patients, you run low on time for pre-rounds. For one patient, you speed through the history and physical exam so as not to be late. For another patient, you had to skip seeing them entirely. During rounds, your attending asked if the patient's sacral ulcer is healing nicely. You did not check the ulcer because the patient is obese and turning them would require finding a nurse to help you. You recall that surgical resident's note from yesterday saying the wound is looking very good, looking better. So you responded with, the wound is healing well. What professional issues arise in this scenario, and how should the resident physician approach this situation? I think this is pretty straightforward as well. What?
I'm sorry, Dr. Tai, I didn't get a chance to examine the patient. The surgery note said that it was healing well. We can maybe examine it as a team.
Good. Did you want to say something else? No. Yeah, it goes back to the breach of lying, right? Lying and fraud. That's misrepresentation. Right? That is part of breaching professionalism. Good. So at the end of the day, our common goal is what? To just take care of the patient. So lying and your attending relying on your report not checking as well, him or herself, can lead to adverse outcome, and we completely miss. And I've seen this case. I've seen somebody with a leg wound wrapped up, and every day no one really cared to unwrap and take a look. So everyone's depending on other people's documentation that the wound is healing nicely, but underneath it, the guy is developing gas gangrene, and he ended up losing his limb, right? So it's okay to not be prepared. I think part of reading up and researching on professionalism what it showed, I think where we can improve and the gap we're having is the difference in generation, right? Back then, your attendings, when they trained, might not have had the access to medical care or the technology that you have now, or the EMR system that you have now, social media. There's generational gap, absolutely, and difference in training experience. So I think it leads back to communication, being able to tell your attending, listen, it's because now you have EMR, there's a lot more records. We order way more labs than we used to. We order way more imaging than we used to. So we have to, it takes longer for us to review than maybe back then when your attending was a resident. So I think having that communication, I'm sorry, I did not get a chance to see all of my patients today. I think all the attendings in the room can appreciate that we rather that response than you saying, and then you lying and said you checked the tele or you checked the wound. So having that open communication, I encourage that during my rotation as well, just to tell me if you don't have enough time and we can find ways to improve. Maybe you need to work on your efficiency, getting here earlier, things like that. For the sake of time, I'm going to skip case 3, but I want to review the HCA mission values. Above all else, we are committed to the care and the improvement of human life. So just keep that in the back of your mind.
And go back one to the case 2, because I think the point
It's an important one.
is the one, I
Okay,
mean, the one I would say of it is really just, I guess if you want to read through it.
Yeah, I can. So you are chief resident of your program. Among your responsibilities is overseeing the on-call schedule for the residents, making sure that there's backup to the on-call system in case of an emergency, and serving as a liaison between the residents and the program leadership. At about 2 a.m. on a Wednesday morning, you get a call from an intern who is on night float in the hospital. He tells you that he just received a call from his mother telling him that his grandmother fell and broke her hip. She is going
Oh, no, surgery.
to have surgery the next day at the hospital in San Antonio. The intern says to the chief resident that he'd like to go to be with his family for the surgery in a few days after to make sure the recovery goes well. You, as the chief, ask if he can finish out his night float shift and then leave in the morning. But the intern replies, this call is really just an FYI. I'm already on the car, in my car on the road. You then call the resident back up on call, who you awoken. Okay, who you working from sleep. You explain the situation and ask her to come in to cover the rest of the night float shift. She replies, you must be kidding. There's no way I'm going to come in to cover a guy that just left. I'd never dump on another resident like that. You should fire him. And hangs up the phone. I think we run into a similar situation like this every year. Please consider the scenario from the points of view of the intern on night float, the resident on backup call, and the chief resident, and answer the following question. What are some of the professionalism issues raised in this scenario?
Accountability.
Accountability, good.
Duty.
Duty,
Respect.
respect, integrity, oh my gosh, all of it. We're missing just 3 more, there were 7. Respect for others, yes. Honor, yes, taking pride in your work, good. I think that was all, right? We listed all 7. Yeah. You guys already have the 7 pillars memorized. Yeah, so what are the professional responsibilities of each person in this case? What was the resident that was on night float, what was his responsibility?
Go to work.
Duty.
Finish his shift.
Finish his shift.
Call the chief before he's on the road
Call the chief
to
before
make
he
sure it's
leaves.
okay to be on
Yeah.
backup.
And sometimes it happens if you receive the news that it's gonna impair, right? It goes back to impairment. It's gonna impair your ability to carry out the job. Then that's okay, you can be excused to leave. But before getting on the road, notify somebody. Make sure there's backup. Make sure there's somebody overseeing the patients. Okay. What is the responsibility of the backup resident?
Be the backup.
Be the backup. All right, show up for your colleagues, you know. Yes, emergencies is gonna arise through your 3 years here or 1 year. And so just show up for each other because the same situation may happen to you and you would hope that your friends will cover for you, right?
Also know that you're the backup. We had issues before where the backup was like, oh, I'm already in Austin for the weekend.
Yep.
So check the backup schedule before you make plans like that.
Goes back to duty and integrity.
You gotta be 30 minutes from the hospital when you're on backup, guys.
How could the situation have been handled better? We kind of talked about it, right? Making sure there's backup coming, communicating before leaving. As a backup, you should step up to the plate. Okay. HCA mission values above all else, we are committed to the care and improvement of human lives. So this is kind of, I don't know, it's a lot, but I'll just kind of emphasize some of the red things highlighted. These are the stuff the program wants me to emphasize to you guys. Top part, top left, abide by the policies regarding your resident absence and PTO, okay? So that's notifying the attending physician in advance, not just taking the day of because you feel like it. Not requesting to work a partial day prior to your vacation. Hey, can I leave early? I'm on vacation for the next week, so I would like to go home in time. That's unprofessional. And not requesting days off that interfere with previously scheduled assignments or call duties. Next is notify the residency program coordinator or chief resident personally by telephone or text in the event of illness or unexpected emergency, just like the last case. Respond quickly and courteously within 15 minutes at all times. So this is very crucial, right? When nursing are texting you, they expect to respond, okay, or I'm on it, I'll take care of it. Hey, I don't know what to do, let me relay the message to my attending. And this needs to be prompt, okay? Carefully review existing schedules and updates to avoid being unaware of ill-prepared by an assignment or scheduled activities. So know when you're scheduled for a new report. Demonstrate their willingness to help in the event of a resident's absence. Goes back to our last case. Represent our program well by demonstrating respect at all times. Okay, even when you leave the hospital, on your weekend, on your days off, you're still a representative of this program and the profession as a whole. Adhere to duty hours, reporting and compliance, complete all requested evaluation on time as required, maintain an electronic and basket and Meditech and patient keeper, complete discharge summary, sign verbal orders, and complete quoting inquiries in a timely fashion. So interestingly, why were we forced to, in medical school have mandatory attendance and you have to come? So it was, an article was written out of University of Washington. It's really interesting because we've been trained since elementary school that you have duties, you have certain things you have to do, right? So why do you need to show up to class when you can just Google everything and just read up to date or watch YouTube or just do questions on NGEM? I can learn it, I don't have to go to class. So why are we expected to come? It's already at an early stage in your life, they're trying to teach you what?
Alert, BH, triage, medical alert, BH, triage, medical, BH, triage.
Responsibilities, right? Just showing up when you're told to show up. Why do you have to turn in your assignment on time? Because now you're going to be the physician that signed your note on time, right? Not pen a note for 3 days, not pen a DC summary for 2 months, right? So it's interesting, this article kind of goes back to since elementary school, middle school, high school, you've been trained on how to be actually a good physician. Okay. Next, takeaway. So just in summary, I want you guys to kind of self-reflect whether tonight or sometimes this week or sometimes during the year. Just always take a moment to sit back and celebrate your achievement. And I was talking to Dr. Kesawan the other day about this. So, it takes a lot of people and it takes a lot of moments in your life to have gone right for you that lead you to be where you are today, right? It took a village for us to graduate medical school. Okay, so here we are. So never forget that. You've gone a long way. You did well on the MCAT, you got into medical school, finished medical school, you're in a residency. So take pride in that. It goes back to honor, right? Prepare for your incoming responsibility. So you are now imparting on a really special journey the next 1 and 3 years of your life. And I still think back into my residency days all the time. You are at a great position of power to really make a difference from your intern year up until your senior year. So always remember that you have new responsibilities. This is not a 9-to-5 job. This is a job where lives are at stake, and so just don't forget it. Don't ever forget that, and take pride in that. Future goals. So tonight, set a goal for yourself in 3 years, or at the end of your TY year. Who do you see yourself, or who do you hope to see yourself becoming? And every day, are you working towards that person? Are you working towards, whatever that image is, right? We all have an image of who we want to be. So that's both your personal identity, your professionalism, who you want to be, versus, and professional achievements. I want to become a cardiologist. I want to become a GI fellow. I want to be a nephrology fellow. I want to be an ICU attending one day, and this is the vision I have for myself. So work towards both of those. Don't ever forget our societal obligations. We touched briefly on the societal contract that we have signed, and so don't forget that. And always, remember our program professionalism and expectations. And with that, I want to leave you with a story. I remember, and this sticks with me for a long time. I worked every Christmas in my residency. It just happened that the schedule's that way, right? So every Christmas I would work. So my third year, I said, again, I'm working Christmas. So I was on ICU night float. Okay, this is peak COVID time, and it was Christmas at midnight. Obviously, I showed up to work at 7. Nobody wants to be there. Nursing, nobody wants to be there on Christmas. Patients don't want to be there on Christmas. And we had a patient in ICU room 6, I still remember. He has no family members around, and his siblings are far away in another state. I don't remember where. They cannot come, but they have made the decision to do compassionate extubation for this gentleman. And so at 11:50, our respiratory tech did her job and did a compassionate extubation. And the charge nurse, the patient care tech, myself, and the respiratory therapist was there at his bedside. And, I didn't even think that was a thing to do. They told me, hey, Dr. Tai, do you want to come with us to, hold his hand? I said, absolutely. So we went to his bedside, we held his hand, and I remember watching him take his last breath or watch his heart rate, grading down on Christmas Eve, leading to midnight, leading to Christmas, right? So I just remember thinking, in what job, in what field do you go through this? Do you get to experience these moments where you're holding somebody who's totally, completely alone, no family around, and that's it, he's saying bye to the world all by himself. So, I still remember that. And so just keep in mind, there's these powerful moments that happen at Kingwood every day, okay? Not just Christmas Eve. You just have to show up, you just have to be here, be present, keep an open mind, and you're gonna be able to experience these and share these really important moments, with your patient and their family members and your colleagues. I depend on my co-residents all the time, and I still depend on them today. They show up to help, that I'm giving a talk. They don't have to be here, but here they are. And so your friends around in this room is gonna really help you get through the next few years, and you will only get out what you put in. So just remember that. With that being said, I want to turn the floor to the attendings in the room, if anything they want to add in terms of professionalism, and Dr. Kesavan is in the back. So when I think my 3 years, what I want to become, Dr. Kesavan is that person I strive towards. So it means a lot that he's here right now. But yeah. I spoke with him earlier this week, and he told me the one advice he has for me giving this talk is to emphasize listening. Just listen to your nursing staff, listen to your friends, listen to your upper level, listen to your attendings, and anything, Dr. Kesavan?
I would also say to add to that,
Without judgment, it's an art by itself, because from medical school, we've been taught to judge. Everything is a judge. The exam is a judge. You judge, you evaluate. So you're so used to judging people, but you lose the art of every time you start listening to someone, you start judging them. So when you judge them and then listen, you're not going to listen and hear what they say. I think listening without judgment, I think it's an art that you have to, it takes time. There's 22 years, 24 years, you've spent all your time judging and then listening. So it's not going to go away in one day. it's gonna take a lot of training, and I think that's what will help you, listening to anyone, for that matter. It can be a nurse, it can be somebody else, it can be a secretary in the ICU, I think that's very important. I think that helps. That helped me, definitely. I listen to the nurses, I believe what they say, and then and sometimes they come up with some interesting suggestion, I take them seriously, and I look at it. So they are happy about it, so they feel they are productive, they are part of the thing, and, I think that's the way it has to be. Just because you're a physician doesn't mean, you are it. That's a thought we always get, but it's not like that. It's more like you have to bring everyone together.
Yeah, as physician, you are the leader of the team. You will be leading a team of nursing, patient care technician, x-ray techs. You are the leader, right? Anything, Dr. Raman?
No, you got it.
Great job.